Risk factors for stroke. Stroke has many risk factors, including health conditions and lifestyle habits. Understanding the different risk factors for a stroke can help prevent one from occurring. According to the Centers for Disease Control and Prevention, every 40 seconds a person in the United States have a stroke. There are many risk factors for experiencing a stroke. If a person is aware of the risk, they can take action to try to prevent a stroke, such as by making any necessary lifestyle changes and managing health conditions. A person who is concerned about their risk of stroke should consult a doctor. Lifestyle and behaviors. The following lifestyle factors can increase the risk of stroke. A lack of physical activity. If people do not exercise, they may develop health conditions that increase the risk of stroke, such as high blood pressure, high cholesterol, obesity, diabetes. Less healthy eating habits. To help lower the risk of stroke, a person should avoid eating a diet that is high in salt, saturated fats, trans fats, cholesterol. High stress levels. A 2022 study found that people with high blood pressure and persistently high levels of psychological stress had an increased risk of experiencing their first stroke or first ischemic stroke. The authors state that they did not find a significant association between stress and hemorrhagic stroke. Smoking. Smoking can increase a person's risk of stroke by 12% for every 5 cigarettes they smoke per day. Tobacco smoke contains many harmful chemicals. According to the Centers and Disease Control and Prevention, tobacco use increases the risk of stroke in the following ways. Smoking can cause damage to the blood vessels and heart. Nicotine can raise a person's blood pressure. Carbon monoxide reduces the amount of oxygen that the blood can carry. Drinking too much alcohol. Drinking too much alcohol can raise a person's blood pressure and increase the levels of triglycerides in the blood. This can increase the risk of stroke. The Centers for Disease Control and Prevention suggest that females should not consume more than 1 alcoholic drink per day and males should not consume more than 2 per day. Obesity. Obesity has associations with higher levels of low-density lipoprotein or LDL or bad cholesterol and another type of cholesterol called triglycerides. It can also decrease levels of high-density lipoprotein HDL, which people sometimes call good cholesterol, increase blood pressure, increase the risk of diabetes. High blood pressure. The American Heart Association states that most people who have had a stroke also have high blood pressure or hypertension. High blood pressure can damage the arteries and may cause them to clog or burst more easily. A typical blood pressure level is 120 by 80 millimeters of mercury. A person may be able to lower their blood pressure through lifestyle habits such as exercising regularly. High cholesterol. In addition to monitoring their blood pressure, a person should ask a healthcare professional to check their blood cholesterol levels. A person with a total cholesterol level above 200 milligrams per deciliter or an LDL level above 100 milligrams per deciliter has a condition called hyperlipidemia. A person with high cholesterol is at risk of build-up in their arteries and called plaque. As plaque builds over time, it can reduce the space inside the arteries. Without treatment, this can block the blood flow from the heart to the brain, causing a stroke. Heart disease. Heart conditions such as coronary artery disease can increase a person's risk of stroke. This is because plaque can build up in the arteries, blocking the blood flow to the brain. Other heart conditions that can increase the risk of stroke include heart valve defects, irregular heartbeat, enlarged heart chambers. Diabetes. People with type 1 and type 2 diabetes have an increased risk of stroke. Type 1 diabetes can damage a person's blood vessels as a result of increased blood glucose. Many people with type 2 diabetes have other health conditions that can increase their risk of stroke, such as high cholesterol. There is no cure for type 1 diabetes. However, people with risk factors for type 2 diabetes may be able to prevent it. Sickle cell disease. Although this condition can affect anyone, it typically affects black children. The sickled shape of red blood cells in people with sickle cell disease means that the cells often clump together. The cells can then form clots which may block blood vessels. If a clot moves to the brain, a stroke can occur. This can also damage blood vessels, causing a bleed in the brain. Risk factors a person is not able to change. Genetics, family history, age, and sex can all contribute to a person's risk of stroke, according to the Centers for Disease Control and Prevention. Age. A stroke can happen at any age, but the risk increases with age. The chance of having a stroke doubles every 10 years after age 55. Sex. Stroke appears to be more common in females. Pregnancy and the use of birth control pills may be contributing factors. Family history and genetics. Genetics may play a role in conditions that contribute to the risk of stroke, such as high blood pressure and sickle cell disease. A person's family health history can be useful in understanding their risk of stroke.